INACSL Healthcare Simulation Standards of Best Practice.
Nursing education is evolving, and so are we. To all the dedicated nursing tutors from Guyana and the Caribbean, your commitment to shaping the future of healthcare is inspiring. In 2023, you participated in the Clinical Nursing Simulation Training, guided by the INACSL Healthcare Simulation Standards of Best Practice, a global framework that ensures safe, effective, and high-quality learning experiences. These standards are designed to optimize nursing education, providing a structured, evidence-based approach to simulation. Let's revisit the key steps that define effective simulation-based training. 1. Simulation design, laying the foundation. Great simulations don't happen by chance, they require careful planning. Each simulation should be designed with clear learning objectives, ensuring that the experience aligns with students' competency levels and real-world clinical challenges. Key components of effective simulation design include clarity, realism, and adaptability. Needs assessment, understanding gaps in knowledge and skills. Scenario development, creating realistic clinical situations tailored to learning goals. Fidelity considerations, strive for the highest level of realism possible, considering the environment concepts and psychological aspects. Evaluation plan, defining measurable learning outcomes to assess student performance effectively. A well-designed simulation bridges the gap between theory and practice, preparing students for real-world patient care. 2. Pre-briefing, preparing learners for success. Before entering the simulation, students need structured preparation to maximize their learning. Pre-briefing includes preparation for simulation, briefing, guiding the learning experience, the simulation experience, and debriefing and reflection. 1. Preparation for simulation. A set of resources to develop the knowledge and skills required for the simulation scenario. 2. Briefing. Psychological safety, creating an environment where learners feel comfortable making mistakes and learning from them. Simulation orientation, familiarizing students with the equipment, roles, and expectations of the scenario. Establishing ground rules, setting expectations for teamwork, communication, and professionalism. A strong pre-briefing builds confidence and reduces anxiety, allowing students to fully engage in the simulation. 3. Facilitation, guiding the learning experience. Facilitation is more than just running a simulation, it's about actively guiding students through the experience in a way that promotes critical thinking and professional growth. Effective facilitators, key skills, and leadership qualities. Adapt to the learner's needs, providing guidance without interfering too much. Use cues and prompts to keep the scenario on track. Balance challenge and support, ensuring the scenario remains realistic yet achievable. Encourage clinical reasoning and teamwork, helping students develop their decision-making skills. The role of a facilitator is pivotal, they help students connect theoretical knowledge to hands-on practice, reinforcing confidence in their clinical abilities. 4. The simulation experience, bringing learning to life. Now, we step into the heart of the simulation. This is where learners engage deeply. Engage with realistic patient scenarios, making real-time clinical decisions. Practice hands-on skills, from patient assessments to emergency interventions. Apply teamwork and communication strategies, working together as they would in a real clinical setting. Simulations vary in format, from mannequin-based training and standardized patients to virtual reality and computer-based simulations. Regardless of the method, the goal remains the same: to create an immersive, interactive environment where students can learn through experience. 5. Debriefing and reflection, where the real learning happens. Debriefing is one of the most critical steps in simulation-based education. It's where learners analyze their actions and decision-making processes, receive constructive feedback to reinforce learning, reflect on clinical performance, identifying strengths and areas for improvement. Effective debriefing follows a structured approach, encouraging learners to describe their experience, what happened during the simulation, analyze their decisions, What worked well and what could be improved? Apply insights to future practice. How will they use this knowledge in real patient care? When done correctly, debriefing enhances retention, builds confidence, and fosters critical thinking, making it a cornerstone of simulation-based education. Why these standards matter? By following these steps, nursing tutors create safe and effective learning environments, helping students develop the skills they need for competent, compassionate patient care. Your dedication to simulation-based education is transforming nursing training in Guyana, the Caribbean, and beyond. Every simulation you facilitate, every lesson you teach, and every student you mentor contributes to a stronger, more skilled healthcare workforce. Thank you for your passion, hard work, and commitment to raising the standards of nursing education. Your efforts today are shaping the future of patient care. This video was developed in collaboration with Professor Fernanda Jimenez, Aurelio Duo, master's student at ERP-USP, and the Ribeiro Preto School of Nursing, ERP-USP, with the aim of contributing to the education and professional development of healthcare practitioners. For more information and access to other educational content, follow the initiatives of ERP-USP Nursing School.